Hi everyone, we're just gonna get started in a couple of minutes. We'll just wait for some more people to log in. Okay, I think we can get started. So, welcome everyone. Thank you so much for joining us today for our lunchtime learning session with the Lung Health Clinic from Jim Pattison. Please do note that the session is being recorded. Next slide, please. Before we begin today's session, I would like to recognize that we at the division acknowledge that we work within the traditional and ancestral territory of the Hul'qumi'num speaking peoples, including the Kwantlen, Semiahmoo, Tawasin, Katzie, Coquitlam, Klukite, and numerous Stolo First Nations, and we are committed to learning and building relationships with the people whose lands we are on. Next slide, please. And now for some housekeeping, please turn your camera on if you feel comfortable. We would love to see all of you. For attendance purposes, can you please make sure your Zoom name shows your full name? You can update this by clicking on participants and then hitting rename. Please do keep yourself muted when you are not speaking. We want to ensure our presenters have optimal audio quality as this will be posted on YouTube. Please use the chat box or raise your hand during our Q&A portion of the session if you have any questions or comments. And finally, in order to obtain your CME credit, please fill out the evaluation form at the end of the session. The link will be provided to you. Next slide, please. And our lovely presenters for the afternoon are Mariah Jones, who is the Manager of Clinical Operations at Jim Pattison, and Aya Kubatani, who is the Lung Health Clinic Supervisor at Jim Pattison. And on that note, I'll pass it on to Mariah and Aya.
Hi, my name is Aya. I'm the supervisor of the lung health program at Jim Pattison Outpatient Care. I have been working in our pulmonary function lab and lung health clinic for about 19 years now, and I have been the supervisor of this program for 6 now. So I'll just quickly go over the presentation objectives for today. First, we're going to talk about lung health clinic service overview, what programs we have available here, how to make a lung health clinic referral and where to find the referrals, common referral mistakes, and then we'll discuss the triage process and patient journey for the various clinics that we run at a Jim Pattison. Next, please. All right, so this is so the Lung Health Clinic is kind of an umbrella service, and we provide many different services here at Jim Pattison. First, we'll discuss the Lung Health Clinic. So the Lung Health Clinic is a unique program in Fraser Health. We will pair an appointment with a respiratory educator so that the patient is able to have diagnostic testing, respiratory education, and a physician consult during the same visit. So within the lung health clinic, we do see patients in the COPD clinic, the asthma clinic, and the interstitial lung disease clinic. We also have a respiratory rapid assay clinic, which is mainly referrals from post-emergency visits or patients that have clinical indicators that don't fit under our other clinics, such as COPD, asthma, or ILD. We also have a pulmonary diagnostics clinic that is a PF lab at Jim Pattison. It is the largest running pulmonary function lab in Fraser Health. We do see anywhere between 800 to 1,000 patients per month in our clinic. That's where patients will get breathing tests to assess lung volumes, diffusion ability, and that helps diagnose patients with different lung conditions. Next would be our respiratory rehab clinic. So this program is for patients with chronic lung conditions that are impacting their quality of life. We have a 6-week education, self-management education, and exercise program that runs out of Jim Pattison. But we do have several formats for this program. We do have an in-person clinic that runs out of Jim Pattison. We also have a program that runs out of the YMCA, Tong Louis, that services our South Surrey and White Rock and some Delta populations. And for patients who cannot make it in person, we do have a completely virtual option. And lastly, we also have a smoking cessation program, which is also the only program running in Fraser Health currently. So this is a virtual 12-week program with our smoking cessation trained therapist and provide support to help patients stop smoking. Next page, please. So these are various referrals to our clinic. So the referrals can be found, updated referrals can be found, first of all, on Pathways. And then the second source would be the Fraser Health medical staff website. So the referral on the left, that is our lung health clinic and pulmonary rehab referral. This one is regional, so all the different site options are available on this referral. The referral in the middle is our pulmonary diagnostics referral, also a regional referral. It will give you all the instructions of what test is available at which site. And on the right-hand side is our smoking cessation referral. Next, common referral mistakes to avoid. Probably the largest information that is missing off our referrals is usually demographics. Sometimes missing addresses, emails, birthdays. We received a referral today where we had a patient name but no PHN, birth date, or address or phone number. We do, depending on the clinic, we do contact the patient by phone directly to book. We do also send letter reminders and instructions to patients through the mail, and that's why these demographics are really important for us to receive. We want to make sure that they're accurate and the most updated information so the patients can receive the instructions from us. Oh, not quite yet. Thank you. We also see referrals sent to the wrong clinic. We do get some referrals bounced back from medical imaging and other clinics at Jim Pattison. So please make sure that the fax number is what's stated on the referral. And we also see some wrong referrals used. There are lots of old referrals floating around in the community. So please make sure that you are using the most recent one. Any referral should be I believe last one would be 2021 and earlier. A lot of the older referrals may not ask for all of the demographics necessary to book the patient. If a referral is too old and it's missing demographics, we will be sending the referral back to the office and asking for an updated referral to be sent in. Another common mistake, not common, I guess this is probably the least common mistake. We'll get referrals where the test requested won't be checked off. So please make sure that that is checked off in the referral before it is faxed off to us. And we also find that the clinical indication is also missing on the referral quite often, and that information is required for the interpreting physician. So please make sure that is filled out before the referral comes to us. Next, please. Thank you. All right, so I'll talk about the triaging process for our lung health clinic. So referrals will be received by us by fax, and all of the referrals are triaged individually by a therapist to ensure that we're booking into the correct clinic. And any referrals that are marked urgent will be looked at first by a therapist and then by a physician if we need their input and triage for urgency. Next, please. And so this would be the patient journey through our lung health clinic. First, when the referral is received by us, and referrals are triaged to the most appropriate clinic by our therapist or physician. Our current wait time is about 4 months for most of our clinics. The patient will be phoned directly to book the appointment. Once the patient attends their first appointment, our physician will decide whether a follow-up is needed, and that will be booked by our follow-up clerk. If a patient is determined stable on therapy, our physician will decide whether the patient needs to be discharged back to the primary care practitioner. Next, please. And this is a triaging process for our pulmonary diagnostics or pulmonary function clinic. Again, the referral will be received via fax. Any referrals marked urgent will be triaged for urgency. So we do prioritize patients with life-threatening illnesses such as cancers. And then the referrals determined routine will be booked in order of date of receival. Currently for our pulmonary function lab, our wait time is 6 months. And I think it's about the middle of the pack for Fraser Health, depending on the site. Some sites are, I think, sitting at about a month. And I think the longest wait time might be up to a year for some sites. If you are looking for wait times for pulmonary function clinic, I do report wait times to Pathways about every 6 months. So it's not completely accurate, but it is fairly close to what our current wait times are. If you would like to look it up on Pathways. Next slide, please. So this is would be a patient journey for a patient coming through our pulmonary diagnostics clinic. Referral will be received by our office. The referral would be triaged and placed in order of receive date. When the test is booked, our booking clerk will be faxing a notification to the referring physician by fax. And then the patient is notified through letter, including the test instructions. So we will mail them instructions about, we aim for about 3 to 4 weeks before their booked appointment. And we also do make a courtesy phone call reminder about a week before their appointment. A patient would attend the clinic visit, the testing is completed, and patient would be discharged. Our PF clinic usually is just a one-time visit with us. Next slide, please. And this is our triage process for the respiratory rehab program. Again, the referral is received via fax. And the referrals will be triaged by our exercise therapist. So we do like, because these patients usually have chronic lung disease, which is impacting their quality of life. So we do like to make sure that the patients are properly diagnosed and on good treatment before they come in to see us for self-management education. So we will make sure that patients are seen by a respirologist first and diagnosed and placed on treatment. If the patient has not seen a respirologist and does not have a firm diagnosis, we will reroute these referrals straight through our lung health clinic so they can be seen by a respirologist before they come through the respiratory rehab program. Next slide, please. Same as other programs, the referrals are received via fax. Our referrals are triaged by our exercise therapist to make sure they have patients to see a respirologist. Patient will be phoned, and an initial intake appointment is booked with an exercise therapist so we can get to know the patient. And then the patient will be offered enrollment into a 6-week group education and exercise program. And at this point, the patients are able to decide whether they would like to attend the program at Jim Pattison, at the YMCA, or the completely virtual program. Once they have completed their 6 weeks of self-management education and exercise, we do offer an additional 6-week exercise maintenance program. Once we're comfortable that a patient has an exercise program in the community, the patients will be discharged from the program. Next slide, please. This is the Smoking Cessation Program. The referral would be received from the physician's office. Patients will be contacted prior to a new cohort. So the Smoking Cessation Program runs for 12 weeks. So we do run 3 cohorts a year. So sometimes there is a little bit of a wait before the next cohort begins. So we will contact the patient prior to a new cohort starting. If the patients are unsure if they want to participate, we do have an orientation session they can attend, and this would be virtual, to see if this is something that would be interesting for them. And then the patients will attend the 12-week group sessions that would be offered virtually. And then patients are discharged from the program. If we do have room, some patients do find it beneficial to attend another cohort. So sometimes some patients are able to attend the program twice, just to provide them a little bit more support, because quitting smoking, of course, is a challenging and long journey. And this is our contact information. So our lung health program runs on the 3rd floor, reception 3C. And that is our phone number there. Lung health program runs Monday to Friday. Our pulmonary diagnostic clinic is located on the 1st floor at reception 1C, and that runs Monday to Saturday. So patients do have an opportunity to come on Saturdays if they aren't able to make it to Monday to Friday appointments because of work schedules. And our last appointment of the day is 5 o'clock. In the smoking cessation program, because it is virtual, we do not have a location, but if they call in to the main reception desk, we can take a message for our therapists. They are usually busy seeing patients during the day, so we will take a message and they will call you once they have time. Next page. Thank you very much for attending on your lunch hour. Are there any questions?
You're muted.
Thank you, Mariah. Thank you, everyone, for joining us this afternoon. Before you head out, please take a moment to complete the evaluation form using the link in the chat that I'm just posted right here. It's important for you to fill it out so that you can get your CME credit and help us improve future sessions. And a huge thank you to Aya and Mariah for hosting today's session. We really appreciate all the work that went into it. Thank you again, and we'll see everyone next time.
Thank you.
Thank you.
Thank you.